Dr. London, you just talked about how bad smoking is for your heart. What about vaping?
Oh, hello. This is going to be interesting. Let's take a watch.
I am on a personal crusade with the vaping because I have had some very personal experiences with young people in particular that have had some devastating consequences as a result of vaping one time.
Personal journey, you say, and people having a devastating outcome from vaping just one time? I have questions, many questions.
Let me qualify this by saying it's new.
New? Really? Vaping was invented by Han Ling in China, a Chinese pharmacist, in 2003, and it was introduced commercially in Europe and North America in 2006, 2007. So is it really new?
And we really don't know what the long-term implications are of vaping.
Yes, it's true. We don't have that understanding of what vaping would do to a person if used for a very long period of time. But what we do know is based on years and years of understanding pharmacology, toxicology, all the research that's done around smoking and how it impacts cardiovascular disease, the lungs, what it means around cancers. It gives us a very good understanding of what we need to look for. Added to that is years and years, decades of modern medical science that has provided us with enormous insight as to what can be dangerous and to what levels. So with all that understanding, do we really need 50, 60 years to get an understanding what these products could do? I don't believe so.
I have seen young individuals vape one time and end up in absolute lung failure to the point that we have to put them on an external lung machine called ECMO through the blood vessels until their lungs actually heal. And sometimes they don't. And several of these young patients died as a result of vaping one time.
So I have questions. How many of these people were admitted to the hospitals and put on ECMO? And what were they vaping? Because we now know that approximately 80 to 100 million individuals around the world now currently use these products. And if these individuals had vaped just one time and they were then admitted to hospital and placed on ECMO, and unfortunately some of them died, could it be possible that they were vaping something other than nicotine? And could it be possible that that product was contaminated or came from a black market source? Is that a possibility? Let's continue.
Now, cigarettes are bad.
How bad? Well, 380,000 Americans die every single year from smoking-related diseases, not vaping-related diseases, and approximately 8 million individuals around the world that die every single year from smoking-related diseases. That bad?
But I've never, ever had a patient die from smoking cigarettes one time.
Well, it all depends on what they were smoking. If they were smoking regular tobacco, then it could take decades for the damage to occur. But if they were smoking a toxic substance that had found its way into the cigarette, they could very well have died just one puff. Science.
The CDC thinks this is so important that they've created a database called EVALI, which is e-cigarette vape-induced lung injury.
Yes, the CDC did create a database, and they were tracking cases of EVALI in 2019. What the good doctor is not telling you is that they stopped tracking EVALI cases in February 2020. Why? Because there was no more cases to report on, as this graph indicates.
2,800 people are already in this database over, and I might not have my years exactly right, 3 or 4 years, with a significant number of deaths associated with it. CDC has recognized this is so important that we're going to have a database dedicated to the injuries that have occurred.
Yes, the CDC did create a database, and they were actively tracking EVALI cases in 2019. And they continued tracking these cases and invited reports up until February 2020, when they stopped receiving reports. And as seen here, they've placed that entire record on archive as there was 0 cases coming in. So could that tell us one thing? That they were tracking a contaminated source for a short period of time, and it wasn't present prior to 2019, and it hasn't been since. So, again, what were these kids vaping? And have we seen any further cases since then? Based on the CDC and all the records that we've seen, no.
Where do I come down on it? Well, no longer are the vape smokers the shun from society like we saw in the airports years ago, with the cigarette in the glass room and everybody wants to be out here, but it's like, why?
Well, there you have it, folks. It's not about public health, and it's not about the patient. It's about stigma. It's about ostracizing individuals that practice unwanted or unsightly behavior, where it's okay to place them in a box on the other side of the field or on the other side of the parking lot while the rest of society enjoys their freedoms. That's what it's about. What really concerns me about doctors that go on platforms like this and have their own accounts on TikTok and Instagram is that gives them the ability to share a whole bunch of nonsense that's not backed by evidence. If they had any contribution to the scientific literature or understanding around these products, they would place these findings in a case study or a case report, which then would be scrutinized by their peers in order to be placed in a medical journal. But they know very well that their rhetoric and the propaganda they spread would not be accepted, because it would literally be scrutinized by their peers, and therefore could possibly be rejected, or even worse, retracted if it gets published. Unfortunately, it is doctors like this that have now added to this growing mistrust around public health, is because they spread information like this without actual evidence. The good doctor did not tell you in any way on this particular podcast what the extent of the problem was and for the period this problem was, or what the actual cause was. This was a very short event which started in July 2019. The cases peaked in September 2019 and suddenly disappeared in February 2020. We hadn't seen these cases prior to that, and we haven't seen it since, because the actual cause was vitamin E acetate, which was found in black market THC cartridges that were vaped. It wasn't nicotine vaping. And you would think that the doctor would have some kind of logic. Maybe it's not. Maybe it's because he's trying to push his numbers on social media. Is that, did we see these cases prior to 2019? And have we seen them since? And have we seen them in any other parts of the world? The answer to all of that is no. So, I am really disappointed that we see doctors do this continuously, because it unfortunately will impact somebody that currently smokes, who could benefit from switching to a safer alternative, irrespective of how frequently they vape or how much nicotine they feel they have to consume in order to stay away from cigarettes. The thing that we know kills millions and millions of people every single year. The good doctor doesn't see that. He only sees his influence on social media growing. Really sad day. Cheers.